Hello, and welcome to this new episode of the Wonder Tooth podcast. Today, we are going to talk about whether to start with aligners or veneers or what to do exactly. But don't forget to use the code DENT52, DENT 52, to get a complimentary consultation for possible aligners or possible smile makeover. I'm gonna put the code in the show notes below. But first, let me introduce myself. My name is Dr. Radwa Saad. I am a practicing dentist in New Jersey. I have been a dentist for over 20 years, and I am licensed to practice in the US as well as in Canada. And I am licensed to do clear aligners as well as implant placement. I have a master's degree in implant placement from the International Congress of Oral Implantologists. And I am also the past president of Mercer Dental Society, which is part of the New Jersey Dental Association and the American Dental Association. So, if you like this episode, please do not forget to subscribe and turn on the notification and make sure you share this episode with your friends if if some of them are interested in getting some aligners or what to do exactly. So let's get started. So first, let's talk about the clear aligners versus veneers. So what are the clear aligners? Basically, these are some form of orthodontic treatment using clear plastic trays. And what it does, it starts to push very gently around the teeth to basically ensure some very minor movement. Okay, and it's very conservative compared to metal braces, in my opinion, and they are much easier to maintain. It's much easier to floss and clean between the teeth once you have clear aligners, and there are a lot of different brands. Invisalign is one of them, Sure Smile is one of them. There is a lot of clear aligners, but the technology is the same. So what's the difference between this? So basically, it's orthodontic treatment versus veneers, which is the cosmetic, smile makeover. And why sometimes we have to do clear aligners first before we do veneers. Why is that? Let me explain that to you, because sometimes some patients, they don't really understand why it's important to do this first before that. But a big part of the problem is the bite. If you have your bite a certain way, like basically you have an underbite or you have a complete very strong overbite, veneers alone cannot fix that. They can enhance it a little bit to a certain point, but cannot fix it. It cannot be fixed like that. That's one. Two, basically if you have an alignment, like a misalignment in the jaw, veneers cannot fix that. And if you have a skeletal problem, which is basically, you are born with like your maxilla is too big compared to your mandible, or, the opposite, veneers cannot fix that. And I'm telling you this, and I do both of them. So I know, I'm not going to tell you, do this better than that. I know both of them. I've dealt with both of them, and I've been doing this for a very long period of time. So really, it all depends on the way you are biting. If your teeth are basically biting in the proper position, they are, in the proper alignment, then yes, veneer can be done without orthodontic treatment. But if your teeth are basically, you're biting edge to edge, or you have an underbite, or you have severe crowding, in order for us to put veneers, we might be cutting much more from the tooth than we should. Okay, like basically it's not gonna be a veneer, then it's gonna be a crown and possible even a root canal at one point. So first, the assessment, we have to, of course, take x-rays, radiograph, and take pictures, and basically assess the occlusion, assess the bite, and see how we can fix the alignment first. If you have very minor crowding or slight spacing, you can aligners, especially if the bite is okay. If the bite is not okay, I would always recommend get some aligners done first, because you want your teeth to be in the optimal position first. And why is that? Because this is gonna, as I said, minimize the need for basically shaving the teeth. So, you know, with veneers, we still have to kind of adjust the teeth, like shave them slightly to be able to put that very thin layer of porcelain on top of it. So if the tooth is like literally crooked completely over the other one, how am I gonna fix this without aligners? How can I fix that? So that means I have to shave that tooth a little bit more, which means we can get, the nerve can get involved in that. Which means, okay, we're talking now a root canal plus a crown, not even a veneer. So the first thing to do is basically straighten the teeth, put them in the optimal position. Then depending on how the teeth look like after the aligners are done, then we can talk about maybe veneers or enhancing them or making them more aesthetically pleasant. You got that part? And why this is very important sometimes to explain to patients, because they come and they're like, I want a smile makeover, I want to fix my teeth. And I'm like, yes, but you do understand there are like now years of like erosion and wear on the teeth that aligners, like the veneers alone is not going to fix it. We have to fix the underlying problem. Why did that tooth became so short compared to the other side? Because your bite is off, because the way you're chewing side to side is off. We have to fix that first. Okay. And why is that important to do it? Because that it's gonna ensure that the veneers, once we put them, they're gonna stay there for a long time. We want to make sure that they're gonna be, you know, the longevity of the veneers, and basically that we're not putting too much stress on the teeth also. So first we have to put the teeth in a proper occlusion. Then we can go and do veneers if needed. Sometimes, believe it or not, if the teeth were not completely worn out from, you know, grinding, or if you're biting on one side more than the other, and you got your aligners done and your teeth, they look, you know, acceptable, sometimes you don't even need to do cosmetic then. Like, you don't need to do veneers after that. We might just kind of fix, you know, a couple, smooth this a little bit, you know, smooth the edge. It's too sharp here from grinding that area. Just we smooth it out and you're good to go. So sometimes it's actually in your benefit to consider to do aligners first if you want to get rid of, you know, the crowding or spacing. Sometimes it can be a little tricky, and it also depends on the amount of spacing that you have and also on the size of your natural teeth to begin with. Like, I have a patient and I told him from day one, after his front teeth were like almost like this, completely outside like this, and with big spaces. So of course something like this you cannot fix it with veneers, absolutely not. So what we are doing now, we're basically closing the gaps and we're pushing them in. However, his teeth are narrow to begin with. They're not like, you know, shaped like they are narrow. So I explained to him that there will be what we call residual spacing once we're done. So after we're done with aligners, the teeth are pushed in and basically we have that proper occlusion. He will still have some remaining spaces between the teeth, and that's because of the width of the teeth. So we're gonna have to go back and fix this with veneers after that. But of course, if the teeth are like this to begin with, nobody can fix them with veneers. They're gonna be like, yeah, don't fall into that. All right, guys. So very important before you go, okay, I saw everybody's getting veneers, it's a new trend now, I want to get veneers too. First, go to a dentist who basically they do aligners, or they can, you know, send you to an orthodontist and they can basically check and analyze your bite first before you decide to do veneers. This is very important, because if they are done without proper analysis, those veneers might start to pop one after the other. And how does it happen? Ask me how. Because if you have an edge to edge and that was not corrected, you keep hitting your teeth, so the veneers on the top are just gonna start to pop one after the other, and you're gonna keep coming. It's like, what's going on? Okay, so please make sure you listen to your dentist and do your, you know, do some research, and maybe try to go for a consultation with an orthodontist as well if your dentist doesn't do aligners, before you jump into cosmetic dentistry right away. And I'm telling you this because I know some dentists, they would just, oh, let me fix this, let's do, oh yeah, we can do this, and then they don't do veneers at this point. We're doing crowns and root canal and it's not needed. Okay, it is not needed. If your teeth sometimes are in good shape, you just have a little crowding here and there, try to get some clear aligners. I understand that veneers, it takes less time to get them done and fix your smile, but sometimes, you know, on the long term, aligners can be the way to go. And then after they're done and your teeth are in proper position, if you don't like, you know, how the teeth look like, then we can do some veneers, you know, a couple of veneers or even a whole smile makeover, but at least the teeth are gonna be intercuspating properly. It's very important that the teeth, basically, when you are biting and sliding side to side, they don't interfere. They're not hitting each other. They basically have to kind of pass through each other, if that makes sense. Especially if you are biting on this, like basically moving your jaw side to side while you're chewing. It's very important that they don't hit each other. Okay, I hope, you know, you're getting some information from this. But also the big thing really also behind fixing the bite or straightening your teeth first before doing veneers is it's gonna make it a lot easier for you to clean and floss between the teeth. I had a patient yesterday, we're doing aligners for him, and he was like, I can really easily floss now between my teeth. His teeth were very, very tight and he couldn't even get the floss in, whether not the one on a stick, not the string, nothing. And I kept telling him, we need to fix the bite. We need to, right now, he can literally floss between his teeth. So imagine if you had veneers done on those teeth when you cannot even floss between the natural teeth, how are you going to be able to floss between veneers? That's going to be a big mess. And as I said, I do both. But first, make sure that the teeth are in the proper position, proper angulation, and it's easier for you to clean between them before you jump into cosmetic dentistry. Okay, I don't want to make it too long, but you have to tell me if you had any experiences, if you had aligners done and the teeth, they don't look them as really how you wanted them to be. Tell me, let me know, send me pictures. You know, you can send them to me on the email or comment below. Let me know if, you know, if that makes sense. Or if you had aligners and now you are in relapse and basically you have some minor, tiny little bit, you know, movement of the teeth. Sometimes it can be fixed with veneers, or it can be fixed also with another round of aligners to fix it. But make sure to comment and let me know about what you think of this episode. And if you like it, make sure you subscribe, because there will be a lot of dental subjects coming up. Like, we're going to talk about more in depth, especially digital dentistry, because that's what I love to do all day long. And also about artificial intelligence in dentistry. And stay tuned, and don't forget, keep smiling with Dr. Saad, and make sure to take care of your teeth so that they can take care of you, and keep smiling with Dr. Saad.